Aloha, and thank you for attending our presentation. I am Dr. Erika Phelps Nishiguchi, an assistant professor of pediatrics at the University of Hawaii and attending physician in developmental behavioral pediatrics.
And I'm Roxanne Bristol, a licensed board certified behavioral analyst and PhD candidate in special education.
Our presentation today is describing an iterative pilot project proposal for group telehealth caregiver behavioral training in our developmental behavioral pediatrics clinic. The pilot project we are describing in this presentation is currently a works in progress seeking grant funding. Our goal is to create a sustainable caregiver behavioral training to support families of children newly diagnosed with autism spectrum disorder. This training will be embedded in the developmental behavioral pediatrics clinic. Nationwide, wait times for initial autism diagnosis are very lengthy. In our clinic, the waitlist for initial consultation has ranged from 12 to 36 months in the last year. Parents' initial requests for support frequently center their children's behavioral challenges and need for learning functional skills. Although often these children are enrolled in governmental services such as early intervention or special education, parents report that they have not received training for supporting their children at home. They are dismayed to learn that our clinic does not offer robust behavioral support, and instead we refer to outside agencies with lengthy waitlists of their own. When all is said and done, children and their families may have waited up to 6 years to receive individualized services, and many may not ever receive services. Increasingly, parent-implemented interventions are seen as a viable and evidence-based tool to provide more immediate support to families. This slide provides detailed text describing the image on the previous slide.
Our proposed intervention will include 3 12-week iterations with interim analysis and adaptation. Participants will be caregivers of children newly diagnosed with autism spectrum disorder in the DBP clinic. Our control group will be families currently on the waitlist with initial evaluations scheduled in the upcoming 3 months. They will be invited to then join the next intervention arm if their child receives a diagnosis or provisional diagnosis at the time of their consultation. The intervention itself is a 12-week session incorporating weekly self-paced modules and group telehealth facilitated discussion. Between sessions, caregivers will complete modules from the freely available Autism Distance Education Parent Training, or ADEPT, published by the UC Davis Mind Institute. The modules introduce parents to applied behavior analysis, or ABA principles, and skills for teaching functional skills and positive behavioral strategies. I'm the BCBA who will facilitate weekly group telehealth discussions to review and cement the lessons learned from the modules and provide opportunities for parents to share their successes and barriers implementing what they learned with their children. This slide provides detailed text describing the image on the previous slide. The interim analysis between each 12-week session will include analysis of pre and post behavior scales and parent stress indices, focus group interviews of participants who just completed the intervention, and updating the curriculum as necessary with relevant cultural or other adaptations to best fit the needs and strengths of our population. This slide provides detailed text describing the image on the previous slide.
Our goals are threefold. 1, to adapt a publicly available parent-implemented behavioral intervention to serve our region's culturally diverse and predominantly rural populations. 2, improve behavioral symptoms in children with new diagnoses even before they are able to access individualized services, thereby improving caregiver self-efficacy and family stress and well-being and overall quality of life. 3, have created a robust curriculum and intervention strategy to present to hospital leadership to support embedding this intervention in our clinic as a permanent support for newly diagnosed patients and their families. We have 2 slides to open up discussion with you. This is a current works in progress, so we have plenty of room to implement your ideas and suggestions into the first iteration of our project, so we'd love to hear from you. Some questions we have so far are, will a group format be too generalized to be effective? Usually behavioral interventions are individualized. One future goal of this project is to expand the behavioral services of this intervention to weekly 1-hour one-on-one sessions with the BCBA, but this is not possible with our current model. Can we adapt the curriculum flexibly enough to be responsive and accessible to our region's cultural and language groups? And what are your thoughts on how we can sustainably support access to web-based content and the telehealth platform.
Please weigh in on the questions on the previous slide, as well as share your experience with similar challenges and your solutions. We'd love to hear your models and curricula. We'd also like suggestions on instruments we can use for our pre and post surveys to measure behavior and caregiver stress and well-being. Mahalo for attending our presentation.
Mahalo!